Obesity is at an all-time high. In fact, 42%, at least 42% of Americans are faced with this. And if you've ever considered losing weight, or maybe that's been a challenge for you, an increasing number of people are turning to bariatric surgery. And we have Dr. Robert Williams here with us today to talk a little bit more about that. He's from New Life Center for Bariatric Surgery. Thank you so much for your time today.
Thank you.
Well, let's first talk who would be a good candidate for this type of surgery, because I know that comes up even before people start, heading in that direction. Fill us in on that.
Sure. Anytime we're considering doing a medical procedure on someone, we want to make sure that the risks are, or I should say the benefits outweigh the risks. So, most of these operations that we do are somewhat invasive. They involve sometimes rearranging the intestine or the stomach, or even removing parts of the stomach. And we have to have a point at which the benefits, the reduction in comorbidities outweighs the risks of having a bad outcome from a complication.
Absolutely life-changing. Some people do assume, though, weight loss surgery can be that quick fix that they're looking for. Not the case. A lot of education and preparation, as you mentioned, going into this to make sure you get those long-term results.
In our program, we actually have them attend an informational seminar before they ever have an appointment with the doctor. That information seminar we sometimes do online or in person. And we like to kind of lay down the information about who's a candidate, what the different operations are, what the complications are, and the steps that they would have to jump through if they opt to proceed with surgery. And I think that helps people decide even before they put the time in of coming into the office and actually have to pay money towards an office consultation or put effort into it. That helps a lot of people decide if they even want to pursue it. So when it comes to educating folks, that's our first step, is our seminar. Now, the second part of it is when patients come in for their office visit after they've had a seminar, that's my chance to actually sit down and get to know the patient, comb through their medical problems, and get down to specifics, the type of surgery that I think they should have, the outcomes, the amount of weight that I think, and even how their comorbidities may respond to the operations. So the final piece of information that we give folks before they go to surgery is everybody is required to go through a diet class. So the diet class usually happens about 2 weeks before their operation is scheduled. That covers the different phases of the diet, what they'll be eating afterwards, the do's and the don'ts. It covers the vitamins that they'll need to take in.
Yeah, absolutely. Talking more about the success of this, who do you find is the most successful in losing, keeping off that weight long term?
Okay. Well, I think people who come into it with the right mindset are going to have better results. I think that it's important to understand that this operation is a tool. It's not a silver bullet. It's not a get out of jail free card. Like any tool, it takes work to get the results that you want to have. And long term, when we look at our patients, I always make this example to patients. If you look around and you see somebody that's in their 30s or 40s or 50s and they're not overweight, those folks in most cases didn't just get lucky and turn out that way. Most of those people who haven't had weight loss surgery are exercising, they're watching what they eat. And after this operation, to maintain those results, our patients have to do the same thing as everybody else. They have to exercise, watch what they eat, and have good habits.
What would you say is the most important thing you want folks to take away before they even consider coming to you all for this type of process?
Well, as much as I'm an advocate for weight loss surgery, I'm going to be the first person who says it's not right for everybody. Getting back to coming in with the right mindset, making sure you're committed to these changes, going through the education process to make sure you know what you're getting into. I think those are very important parts to get the kind of results to have an idea of which direction you're headed. I think it's very important.
Thank you for sharing this education and time with us. Very important information for our community. Folks can get a hold of you guys, I know, by your website, also give you a call to even come in and see where to begin in this whole process, I imagine.
Sure.
Absolutely. Well, we appreciate you. And guys, we will have that phone number as well as the website up on our website, livingeasttennessee.com. All you have to do is click under the health section and look for this information from the New Life Center for Bariatric Surgery. Doctor, thanks again.
Thank you.